I know you've spoken a lot about living with COVID, which we need to do, we need to focus on. But the other issue right now, hospitals seem pretty close to breaking point, particularly around staff in New South Wales. Is this a concern?
Well, the ICU capacity is key, and there's still a lot of ICU capacity in New South Wales. I think the Premier has flagged that next month will be a big test for that. And so that's why it's important that we don't have a huge explosion whilst we proceed with our restrictions.
So that's the key. I mean, she's spoken about the capacity. There's a lot of talk about ventilators. We need people operating them. It's not just the capacity of the system, but it's all these health workers either getting COVID or isolating that's straining it, right? Does it make us think how many cases New South Wales can have, even with 80% and then opening up?
Well, that's why we need to have some restrictions in place until we get people to be vaccinated. Now, the good news is that New South Wales is leading the nation in terms of vaccination rates. And so I'm optimistic that over the next 2 months we can get to 80% in that state, and then we can have less focus on those sort of, frankly, quite depressing stats.
But they are. I guess the thing that would be good to have is a parameter from Doherty, because all we heard was, well, Doherty didn't model this on 0 cases, and fair enough. But at what point New South Wales cases might be too high to stick to those opening milestones?
Well, that's something that you'd have to put to Doherty, but I
think the government be getting that specifically, though? And it won't be a single number, but again, a parameter?
Well, I think the executive government has shown that it's always happy to get more advice, and I imagine that's on the cards if it's required. But the key numbers at the moment are hospitalisations and ICU admissions alongside the vaccination rates, and you'd have to say that we're way ahead of where we thought we'd be on vaccinations.
We are, but then the hospitalisations are steadily going up.
Well, hospitalisations is not the same as ICU admissions, as you know. I think that's where you're really worried about getting out of control if you felt that you weren't going to have enough ICU beds. And my understanding is that is nowhere on the cards at this stage.
What about a lockdown light? From where we are now for Sydney side, and this applies to Victoria, I would argue, to ACT, what we can do in the interim rather than just a harsh lockdown. I mean, it's great that a few people can gather outdoors from New South Wales. We need more than that to get to November or whatever, don't we?
I think so, and I think I'd like to see much more for the double vaxxed, and I think that we need to be looking at how we can help small business, because people discuss mental health impacts all the time, but it really is people that are in small business that bear a disproportionate brunt. People in hospitality, tourism, barbers, hairdressers, travel agents. And you'd like to think that over the next month or so, in places where you have a low level of cases and people that are vaccinated, they could have an outside meal.
Right, so you'd want something pretty soon announced on that, because it's about when it happens, but also some hope for some businesses that might right now be thinking about packing it up.
Well, Tom, I mean, 6 to 8 or 10 weeks is a long time when you've already been in lockdown for...
6 to 8 to 10 more weeks.
And the disaster payments, I think, help tide you over, but they're not going to replace your income. And if you're a small business, you don't have a lot of fat. I mean, I'm talking to a lot of people, and there's a lot of people under a lot of pressure. So we want to try and give them as much hope as we can. If it's safe to have an alfresco meal, in Martin Place or something, then why not?
What about rights to non-vaccinated? I mean, when they opened up the outdoor gathering of 5 people, couldn't you have settings where even unvaccinated people could do something? Because otherwise, if you're not getting vaccinated, you're probably less likely to follow the rules as well. And instead of gathering outside, you'll gather inside and the spread continues.
I mean, I'm quite attracted to what President Macron said about where France was going to go with this pandemic. And that is that once everyone's had a chance to have a couple of shots, then this becomes a real problem for people who have chosen not to do that. And so I think we want to reward good behaviour, and we should be focusing on how we can give more freedom to people that have had 2 shots of this vaccine.
So specifically, does that mean once everyone's had the opportunity, at that point, everyone can do everything and the people who aren't vaccinating run the risk of getting sick?
Well, I think it needs to be well and truly flagged, right? But I would say that when we need to be open at Christmas time, I mean, people need to be able to access international travel as well in the new year. And these are going to be opportunities that are only available to people that have chosen to have the vaccine.
You talk about being open, but the national plan's not really holding already, is it? Some of the other states and their attitudes, WA in particular.
Well, I can't speak for other states, but I can say that New South Wales
is doing what they're saying.
Well, I mean, I represent the people I represent are under a lot of duress at the moment, and I want to give them as much encouragement as I can to have the vaccine, and then be able to say to them that then I hope that you can travel early in the new year, including overseas.
Would you be happy to see the federal government cut off any sort of assistance to WA if they're choosing to go into a lockdown to get to COVID zero, even once they're at 80% vaccination?
Look, I think it's been well flagged by many that some of the settings that are being pursued in certain jurisdictions are not realistic. I mean, major cities can't keep Delta out. And so COVID zero, I think, is a dead duck. I don't think that's a sensible and honest policy for people to hold. I don't think Australia should be held back by that approach. I'd like to see New South Wales be open to the world if we hit 80% in November.
So in November, international flights?
Well, as soon as possible. I mean, why would we be holding it back?
Well, you possibly import... Sorry, and is that without any sort of quarantine on income?
I mean, I think New South Wales...
Is that without any sort of income? So if someone comes from the US, is it any country or is it a list of countries?
I mean, we'll take the medical advice at the time, but if they've had their vaccinations and that's compliant with Australian
vaccinated
standards...
travel, whether you're from the US or wherever, if you're vaccinated, free to travel, no more quarantining.
We're not going to have unvaccinated people come through Australia. That's pretty clear. I think you know that. But my point is that New South Wales has borne a fair degree of the burden with hotel quarantine and the like. I think that there should be more freedom.
Andrew Bragg, appreciate your time.
Thanks, Tom.